Mrs. Stroder, it's good to see you. I have a few questions for you before Dr. Stafford comes in, okay?
Sure.
All right.
The behavioral health screening tool starts when the rooming staff enters the patient's chart and enters some vital signs, specifically when the heart rate is entered and the rooming staff closes the vital signs section. A BPA, or best practice advisory, will show up indicating that the patient has not had behavioral health screening done within the past year. Rooming staff clicks on the flow sheet. This brings the rooming staff person into a documentation flow sheet where they can begin to enter the behavioral health screening tool. The initial two questions for PHQ-2, so does the patient have, over the past 2 weeks, lack of interest or pleasure in doing things, and are they feeling down, depressed, or hopeless? We'll automatically sum the two scores for a total PHQ-2. Rooming staff will also ask about Audit 1 or alcohol screening, and whether the patient has misused any prescriptions. In most cases, approximately 80 to 85% of screening cases will be negative. The rooming staff will finish at this point. If the PHQ-2 score reaches a total of 4 or higher, the screening tool automatically opens up an additional set of questions for the entire PHQ-9. The rooming staff would then come in, complete these additional items, and work their way through. And get a total PHQ score for PHQ-9. You'll also notice that with a PHQ-2 subtotal of 4 or higher, not only did it open the additional PHQ, but it also now opened the GAD-2 for anxiety screening. This is because of the high prevalence of anxiety and depression. Again, the rooming staff will come in and answer the two questions for anxiety screening. If screening is negative, it stops at that point. Or if the screening is positive with the initial two questions, it will now open up the additional questions for the entire GAD-7. Rooming staff can come in, complete this section, and there will be now a GAD-7 subtotal calculated by the system. In the event that the patient declines to complete this screening tool, or at the discretion of the rooming staff, for instance, if the provider is behind schedule, they may elect to document that the patient either declined or that the provider at their discretion has decided not to complete the screening at that visit. Once these screening tools are completed, the rooming staff will close the workstation